Now, a new study has found that serious shortfalls in the standard of healthcare for many Australians are a concern. Researchers from the Universities of New South Wales and South Australia looked at the treatment of more than 1,100 patients. They found almost half received substandard care. Professor Jeffrey Braithwaite from the University of New South Wales was involved in that study, and he joins us now from Sydney. Professor, good morning to you. When we talk about substandard care, what do we mean?
Good morning, Michael. We found that about 57%, more than half of care, is in line with best practice, international best practice. About 43%, on the other hand, is care that is not at that level. This might be care that's a little out of date. It might be care, the health system's a moving target. It's hard to get it right all the time. Lots of patients coming through, lots of technology, but also it might demonstrate substandard care, pockets of not excellence, but pockets where we can really strengthen the health system and improve it.
Who's at fault here? Is it a case of doctors and surgeons not being diligent enough?
I don't think that's the case. Well, it can be in some cases, in some isolated cases, but for 43% of care which falls short of international best practice, some people may not have got all the indicators, say, for asthma or antibiotic use. Some people may have got version 2 of a drug when version 3 is available, or a different kind of treatment by agreement between the practitioner and the patient.
Just reading one of the findings of your study, only 18% of patients with asthma got a documented action plan, which you'd assume is the base level required for any asthma patient.
Yes, this is one of the more troubling aspects of our study. 18%, as you say, of asthma patients. Most of the time, asthma is not going to kill you, but it's really useful if you have a plan and you really are aware of that plan and you've been briefed by your doctor about what are the things that you can do to make sure that you don't get into trouble with your asthma.
Jeffrey, how do we improve on this? How do we ensure that all these people in future years aren't getting substandard care?
We think a couple of things. One is we did a study that looked at 35,000 encounters of patients with the health system, and we had to get approval from 225 ethics committees. This is a 3-year massive study. We can't really do this every time we want to look at the health system. So we've called this study Care Track, and we need to track care across time on an ongoing basis. The other thing we're suggesting is it's really important for patients to understand what best practice is for their condition. So we're getting doctors and nurses and allied health professionals together with their patients within the conditions that we've examined to look at how can we express the best practice care that needs to be delivered in simple ways. So people have, for example, a smartphone app that allows them to understand when they go to a practitioner with a condition exactly what best practice is for that condition. We're also working on Wikipedia entries to look at how can we express what best practice is and keep it up to date through the well-known Wikipedia system that your viewers will obviously access for other things in their lives.
Jeffrey Braithwaite, we wish you well on improving that statistic. Thank you very much for joining us this morning.
Thank you indeed.